What is autism?
Autism is a complex neurobiological condition that tends to appear in the first 2 years of life. It presents by affecting speech, socialization issues. Also, there is a significant amount of attention issues and learning disabilities in autism. It is a genetic condition, but we do feel that there are possibly environmental triggers that need to be looked into. Autism is also a lifelong condition. So a person with autism will have autism their entire life. However, it can be treated, as you said, and we see remarkable improvement when early intervention happens, so that these folks who maybe 10 years ago were never going to be independent are now able to live interdependently and possibly independently with some supports.
Is diagnosis still an art, or is it a science? Can we, as in other diseases, look at something in the blood, look at something externally, physically, neurologically, and say, this person yes, this person no?
It is a science which unfortunately is looked at as an art. So what I mean by that is there is no blood test because there hasn't been one gene and one indicator. There are very good assessment tools that can be done by psychologists and teachers very early on. In fact, we have research that shows at 12 months you can start seeing the signs and get early intervention. Unfortunately, access is the issue. And so consequently, we still have an average age of diagnosis of autism in this country of age 4.5 for whites and 6.5 to 7 or later for Hispanic Americans, African Americans, and Asian Americans.
Ana Gardano, how do you explain that gap?
Well,
Because especially since time is of the essence, we're told,
Right.
and yet here's this multi-year gap in the diagnosis.
Well, one of the issues is that Hispanic children speak Spanish, usually until they start school. Many of them start school at 5. And by then, the teachers could really identify some of these things. But if the child is in an all-English class, they could be misdiagnosed as, oh, they're just learning English. That's why they don't talk. They don't know English yet. So that's one of the issues. The other issue is the parents may not know. They may not have enough information. That's why this program is so important. Because
But, if your kid is starting school, everywhere in the country you're required to visit some sort of medical facility and get some sort of examination and assessment and get a battery of inoculations. There is a compulsory encounter between the young child, the parent or guardian, and a doctor. So when you hear 6.5 or 7 for first diagnosis, you think, well, it's not, yes, there is underservice, chronic medical underservice. Latino kids are not getting enough health care, but starting school is one of those times where we know the kid's going to see a doctor. How do they miss it then?
well, you mean the doctors?
Yeah.
They may not know enough about autism. I'm talking, my experience is more about schools. And when they start school, a lot of teachers, in fact, I had a case recently where they tell me, oh, this child has attention deficit disorder. So I get there and the child is toe walking, flapping his hands, doesn't talk. That's not attention deficit disorder, that's autism. So the teachers didn't know. And then they're also trying to tell me he's mentally retarded. The child had only been in school for 1 year, and he was 5 years old in an all-English class. So now the opposite could happen, where the child just doesn't speak English, they're withdrawn, they don't have the eye-to-eye contact because they're afraid to talk or they don't know what's going on. So then they could say, oh, maybe that child is autistic. So I think what's needed is psychologists to do evaluations. I'm not sure medical doctors are trained to really assess the behavioral characteristics.
Mary Holland, is part of this complicated by the fact that being autistic is not a yes-no proposition? There's a range so that someone can appear to be fine at one end of the spectrum and really out of step with kids their age at the other end of the spectrum, but there's a lot going on in between.
Absolutely. This is a spectrum disorder, which makes it more complex. There are people who are highly functional, who are computer experts, who have no impairment of their speech. And it goes all the way to people who are nonverbal, who often have medical complications that are associated with mental retardation, seizure disorder, could be gastrointestinal systems. This is not just a neurological problem. This is an all-body issue for many people on the spectrum. And so we have to look at individuality in what is, I believe, an epidemic.
But does the spectrum actually complicate things?
Absolutely.
Because there are people who are considered autistic, who are given that label, given that diagnosis, which sort of muddies what autism is if you're trying to teach the public, if you're trying to tell parents what to be on the lookout for. We've thrown so much into that basket that all kinds of things are being called autism when they're not.
There's no question. And the basket itself is changing. You know, it used to be called infantile schizophrenia. Now they're talking about throwing Asperger's syndrome, which is the highest functioning, back into the autism basket. It's been a changing basket, and it's a basket that includes an unbelievably broad range. But there are commonalities and a common core, and that is issues about socialization and speech. Those are two of the primary areas.
Well, Marguerite, is it even useful to have a child who can go through the school day, who can speak, who can read, who can communicate, who is toilet trained, and talk about them having the same disease as a 9-year-old kid who's still wearing diapers, can hardly walk, and cannot speak?
It's not only useful, it's critical.
Why?
It's critical because the commonalities of autism need to be treated. So as my colleague here says, the socialization issues, it doesn't matter if you are the 9-year-old in diapers or the 21-year-old who is having a hard time finding a job. You need social skills training. A person with Asperger's communicates in that he speaks, but he doesn't communicate appropriately to get a job. Very importantly, as Mary mentioned, the medical issues that we're finding to be comorbid with autism need to be treated. So currently you get an autism diagnosis, the doctor checks you out of the medical system into the behavioral system, doesn't look at your gut, your seizures, your other issues that are presenting with autism. So I would argue that having those, that spectrum diagnosed as autism and defined appropriately is going to be critical for these kids to get services.